There are many different ways to give medications. Some medications will not work properly or may even be dangerous if not given correctly or at the correct time. Always double check that you have the right medication, the right time, and the right dose. Not all medication routes will be covered in this video. Please refer to the family training links for Diastat, intranasal Versed, and/or Lovenox injections. Medication given by mouth can come in a liquid, tablet, capsule, or powder form. Some long-acting medications should not be crushed. Check with your pharmacist to be sure your medications can be crushed. For children that are able to take pills or powder by mouth, these can be mixed with a small amount of water, applesauce, or pudding. Tube medications can be given through many different tubes that route to the stomach or part of the intestine. G-tubes, GJ tubes, PEG tubes, NG tubes, NJ tubes are a few types you may see. Read the label of the medication carefully if the tube has more than one port on the button. If giving through a tube such as a G-tube or NG tube, tablets can be crushed finely and mixed with water. Capsules can be opened and mixed with water. Some long-acting medications should not be crushed. Check with your pharmacist to be sure your medications can be crushed. Flush the tube with water when you are finished administering. Sublingual medications are given under the tongue in drop, gel, or dissolvable tablet form. Nasal medications can be given by drops, spray, or atomizer. If needed, suction out the patient's nostrils before giving. This helps the medication to be absorbed better. Please refer to the family training links for demonstration of intranasal Versed. Eye drops and lubricant are administered into the lower lid of the eye. For eye drops, pull the lower lid down and drip into the pocket formed. With eye lubricant, you will pull the lower lid down and place a ribbon of medication into the pocket of the lower lid. Do not touch the tips of medication tube to the eye to keep it clean. If giving ear drops to someone under 3 years old, gently pull the ear down and back. If the person is older, pull the ear up and back. This allows the medication to drip into the ear canal. Dripping the drops down the side of the ear makes drops more comfortable to the patient. Use lubricant to give rectal medications through the rectum or anus. After giving of anything rectally, hold the patient's buttocks together for a few moments to keep medication in the rectum as long as possible. Tracheal medications can be drops or spray into the tracheostomy. Patient may cough with these medications. Monitor for comfort as needed. Inhaled medications can be inhaled by the mouth or tracheostomy site. Medications can be delivered by nebulizer or inhaler. Spacers may be used as well. If you have questions on using a nebulizer, inhaler, or spacer, please refer to your respiratory therapist educator. Topical medications can be in cream, drop, gel, or patch form and go on the skin. If placing a patch, double check that the old patch has been removed before a new patch is placed on the skin. Cover the patch with a clear dressing if needed to keep it from falling off. Subcutaneous injection is an injection given into the fatty tissue of the body. Smaller needle sizes are typically used, such as 25 gauge to 30 gauge needles, and inserted at a 45 degree to 90 degree angle, depending on how much tissue is present. Common locations are the back of the upper arm, stomach, or inner thighs. If you have any questions, please contact your nurse educator.